I think this is our group for tonight, and I'm Louise Blasius. I'm the Director of Human Services here at McKenzie Health System, and I'm also the local facilitator for the Alzheimer's Disease support group. And I have flyers and any literature over there that you'd like, you're welcome to take. The Alzheimer's Disease support group meets the first Friday of every month at 1 o'clock here. And the Alzheimer's Association, the Greater Michigan chapter, they had their big walk this weekend. Well, they have a trainer, Lauren Centnar, and she volunteered to come up and do a training for us. So we're going to do that October 4th from 11 to 1 right here. And the people from the support group, they chose the topic living with late stage Alzheimer's, because they've been with the group for a while now and their loved ones are progressing down the dementia track. So that's our program, and if you're interested, just call me or Tanya and we'll get you signed up. So one of the things I wanted to make clear today was forgetting is normal. Absolutely, positively normal. If we didn't forget, we'd be stark raving mad before the end of the week. It's, you know, it's normal to forget. And for me, what happens is I forget, and then the next day it comes back, you know? Who was that at the grocery store or whatever? And we have, typically we say we have two types of memory. We have short-term memory and long-term memory. Our short-term memory is our working memory. That's how I can remember who I dialed on the phone, you know, running to that I need to stop at the grocery store, how to get home. That's all part of my short-term memory. Long-term memory is stored deeply in our brain, and it's like a road that you have driven a car down many, many times, a dirt road, so the tracks are really rutted in. So my favorite memories are Christmas memories. So when you come visit me next door, start talking to me about remembering Christmas, because I've played those memories over and over and over. So they're very well stored in my brain. And then there are lots of causes for forgetfulness. The most common is stress. And if I'm under stress, to do introductions, every single name has flown out of my head. But there's many different ways that stress can cause us to be forgetful. The second most common cause of forgetfulness is depression. And if a person gets their depression treated, their memory also improves. Half of all people with Alzheimer's disease or related dementia will experience depression. And research shows if you treat the depression in the person with memory loss, their overall functioning becomes better. We may have increasing sensory loss, like we're not seeing well, or more importantly, we're not hearing well. If you don't hear it in the first place, you can't remember it. So very important at all levels to keep your vision going well and your hearing. We may have some emotional stress, maybe the death of a loved one. Polypharmacy, one too many medications, and that's one of the primary reasons the person worried about memory loss should go see their doctor, because their clinician can sort out whether it could be a medication to medication interaction. If there is a depression, what else is medically going on with us? Good to go to the doctor if you're worried about forgetfulness, because it doesn't automatically mean Alzheimer's disease. If we're poor observers, to begin with, have you ever parked your car in a big mall and forget where you parked? I did that once. I remember I was in college and I was so excited to get home to my local mall. I parked it to run into the mall. Not a clue. I walked miles around that parking lot before I found my car. So that's something I always take keen observation of now. Where did I park? We don't remember the unimportant, except sometimes what I think is unimportant, somebody else might have thought was important. And there's a great brochure over there. What do we know about preventing Alzheimer's disease? And top of the list is diet and exercise, and then staying socially connected. So we can do a lot to improve our brain functioning. And when Lauren Sentner, the trainer from the Alzheimer's Association, was here last spring, she pointed out that the Greater Michigan Association of Alzheimer's Disease has this wonderful tour of the brain, and I just loved it. So we're going to tour. I don't want to stand in anybody's view. Oh, what did I can get it back. No, I can't. Oh, thank you. Thank you. Do I have to go back to the website? Okay, now I get, with the roller, okay. Okay, so our brain weighs about 3 pounds. So we have the cerebrum, which fills up most of our skull, and it is involved in remembering, problem solving, thinking, and feeling, and it also controls some of our movement. The cerebellum sits at the back, at the base of the brain, and it controls coordination and balance. And then the brain stem is in front of the cerebellum, and it connects to the brain and spinal cord. And it helps us with our automatic functions, such as breathing, digestion, our heart beating. Think if we had to count every heartbeat, we wouldn't be able to do that. So with each heartbeat, arteries carry about 20 to 25% of your blood to your brain, and that's where billions of cells get their oxygen from. So it's important that we have good blood flow to the brain, and that's why when a blood flow is interrupted, as in a clot, a stroke, that can be so deadly. So we had the stroke busting, clot busting injections here, and it's, we get a CAT scan, make sure it's not a bleed, and then you can get the injection. So our cortex controls our vision. It processes sounds for us and smells, and it helps us in problem solving and planning and forming memories and controlling our voluntary movement. One of the dementing illnesses, diffuse Lewy body. Lewy bodies sometimes float across the cortex and can cause severe hallucinations. We also have a right side and a left side to our brain. So the left side of my brain controls my right half, and my right side controls my left side. And then we have a neuron of brain cells and branches, and they signal one to another.
Different.
Am I okay?
Yeah, I was just gonna.
Oh, thank you.
Is that where you're supposed to be?
Thank you. All right. So, one nerve cell sends an electronic message over to the next one, and that's how they communicate. And these are nice, orderly brain cells. So here you can see the cells firing up and connecting and giving a message. Oh, rolling is better. Thank you. Yes. Okay. So these pictures are pictures of the brain from PET scans, and this part of the brain helps us with reading words, hearing words, and there's 100 billion nerve cells that are communicating one to another. And now, am I going to click? Yeah, I want to go there, so I click. Now, here is a brain with Alzheimer's disease. So, the one on the left is a normal brain, and then the spaces get bigger, and there's also shrinkage. So there's more space in our white matter, and there's also shrinkage. That's called atrophy. And then Alzheimer's disease is caused by plaques and tangles. Plaques are abnormal clusters of protein fragments, and they build up between nerve cells. And then dead and dying nerve cells contain tangles, which are made up of twisted strands of another protein. So they really feel this clumping up is real damaging to our thinking skills. So here are some more plaques, and a plaque is caused by beta amyloid. That's just a name for the protein that it is, and beta amyloid is chemically sticky and gradually builds up new plaques. The most damaging form of beta amyloid may be groups of a few pieces rather than plaques themselves. The small clumps may block cell-to-cell signaling at synapses. They may also activate immune system cells that trigger inflammation and devour disabled cells. Here's another picture of plaques. A protein called tau helps keep the strands straight. In areas where tangles are forming, nutrients and other essential supplies can no longer move through the cells, which eventually die. Tau collapses into twisted strands called tangles. So it's amyloid plaques and tau tangles. And we could do the... All right. And then this progresses throughout the brain. Plaques and tangles are seen in the blue shaded area, and it tends to spread through the cortex. A predictable pattern of Alzheimer's disease progresses. The rate of progression varies greatly. On average, a person with Alzheimer's lives 4 to 8 years after diagnosis, but can live as long as 20 years depending on other factors. The course of the disease is in part on age at diagnosis and whether a person has other health conditions. So early, mid to moderate to late stage. And here's another picture of early stage, where in our cortex, also where we do our learning and memory, our thinking and our planning. In mild to moderate stages, brain regions important in memory and thinking and planning develop more plaques and tangles than were present in early stages. As they interfere with work or social life, they may get confused and have trouble handling money, expressing themselves, and organizing their thoughts. Many people with Alzheimer's are first diagnosed in these stages. As Alzheimer's disease progresses, individuals may experience changes in personality and behavior and have trouble recognizing friends and family members. So one phrase I learned at the University of Michigan is there's an accentuation of pre-morbid characteristics. So that means the worst thing about you before your dementia gets blown out of shape in your dementia. So I say, just think if I had turned into my PMS personality, right? Machine gun for everybody. But, you know, if you are a happy Hannah, you tend to stay a happy Hannah throughout your life. I had my aunt's mother-in-law, always happy. And even in her dementia, she was happy. Or if you were a grumpy Gus, you might be really grumpy. And then here's severe Alzheimer's disease. Most of the cortex is seriously damaged. The brain shrinks dramatically due to widespread cell death. Individuals lose their ability to communicate, to recognize family and loved ones, and to care for themselves. In our support group this month, they just wished for a simple thank you. You know, if a person can still say thank you, even though you're doing so much for them, it means so much to say thank you, because caregiving is not easy. Questions so far on the tour?
Were these scans on a living person?
No. Well, the PET scans are.
Okay.
The PET scans, and they're doing PET scans now a lot at U of M. If you go there for a workup, they can do a PET scan. So, Dementia 360, seeing dementia from everyone's perspective. I'm not going to cover everyone's perspective tonight, but I'll cover a lot of them. And who should be the center of our attention? The person living with dementia, of course. Am I?
You just got to be over the screen. There you go.
So a person with dementia has changes in memory and thinking, changes in understanding and speaking, changes in impulsivity and initiation. Sometimes it's very hard to initiate, and changes in abilities and processing. And this is my favorite slide. I think a question that I get asked more than any other is, what's the difference between Alzheimer's disease and dementia? Dementia is the umbrella term, and there could be, the Alzheimer's Association says there's 100 different diseases that can cause a dementia, but we're going to talk about the most common ones. The most common one, of course, is Alzheimer's disease. And in order to be a dementia, it's always progressive, always. So in Alzheimer's disease, a person might start out here, and then they have this downward slide, 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 slide. And it's progressive. In vascular dementia, also called multi-infarct dementia, that's dementia caused by multiple strokes. So a person is doing just fine, has a stroke and a decline in behavior, doing okay, another stroke and a decline in behavior, and another stroke. So vascular dementia is stair-step, and then an excellent reason to get diagnosed and worked up is to prevent the next stroke, because then you can prevent the next decline in behavior. So I was just saying dementia is always progressive. Alzheimer's is the most common. Vascular dementia is next, caused by multiple strokes. Then I already gave a hint at Lewy body dementia. Diffuse Lewy body are brain protein clumps that clump up where they don't belong. And in Parkinson's, that you'll see that's causing the tremors and all. In diffuse Lewy body, very much characterized by good days and bad days. The good days, all of those particles are clear. The bad days, they've clumped up somewhere. And if they clump up across the visual cortex, people will have very serious hallucinations. You know, a person with Alzheimer's, they may just be misinterpreting a shadow. But, you know, people with diffuse Lewy body might have children in their room and be, you know, very detailed about it. There's also frontotemporal dementia, and our editor that lets me know what to do, is in charge of me, goes first. So people with a frontotemporal dementia, they can become really impulsive. They lose speech early on, and it goes faster. I think it has a much faster course than Alzheimer's. And then other dementias could be genetic syndromes, metabolic, alcohol-related, white matter disease, a brain tumor effect, other mental conditions like depression, and infections can cause people to be goofy too. And I was talking with a lady here last month, and she said to me, she said, "Can alcohol cause memory loss?" I said, yes. I said, you know, a person's chronic, it can. And she came to realize that that was what happened to her husband. He also came to quit drinking, but the long-term effects were still there. Okay. So in Alzheimer's, new information is lost. Recent memory is worse. Word finding becomes difficult. So I've seen people go to like 3-word sentences, and then sometimes there are people who just, they sound like they're stuttering. They can't get out a whole word. They misspeak themselves. They tend to be indecisive. They can get lost, like in the grocery store or driving home, which one shouldn't be doing. So the Alzheimer's Association does support safe return bracelets, and you can purchase them through the Alzheimer's Association, and then you register your loved one. So if they do wander off from you at Walmart or wherever, it takes a police officer to find the person, then call the toll-free number, and then they're ID'd by the ID number that they have. So you can't be taken advantage of. If somebody finds you wandering around at Jeff's, they might want to go to, rob, but you can't with that system.
Your actual name is not on the bracelet.
Your name is not on it. But when the police call into the central warehouse, they know everything. They'll know your spouse's name. They'll know who to call in case of emergency. They'll know what nickname you like to be called. There's a complete file on you, but your name is not on the bracelet. So again, vascular dementia, sudden changes, sudden onset. People with Alzheimer's creeps, but with the vascular dementia, it can be very sudden. You can have spotty losses and emotional shifts, and your judgment and your behavior are not what they used to be. So I remember this one couple I met. I actually made a home visit, and she had Alzheimer's disease, and he had vascular dementia. She got stuffing her underwear in the toilet so it wouldn't flush anymore. He thought he should be able to repair the toilet, but couldn't. So they were peeing in their backyard, or all of their toileting in their backyard. The neighbor was having company come up, and he finally called the daughter and said, "Look, I have company coming. Could you please keep your parents from toileting in the yard?" That was the first time that it really, came to their attention.
What are spotty losses? Spotty losses?
Yeah, I might do well in church, but take me to a movie theater, that's too much confusion for me, or so you're good in some things and bad in other things.
Thank you.
Good question. Whoops. Lewy body, movement problems, falls, the visual hallucinations, the fine motor skills, episodes of rigidity and faintness, nightmares, fluctuations in abilities, and drug responses can be extreme and strange, like Ativan or something like that. So, questions on Lewy body? Okay. Frontotemporal, frontal impulse and behavior control, says unexpected, rude, maybe even mean things. Who is the grandmom on Golden Girls? The old lady.
Blanche's mother.
The mother.
Esther?
Okay. You might think of her as the person with a frontotemporal dementia, because anything would come out her mouth sometimes.
It's my brother's favorite.
And then
Sophia.
being able to speak is lost very quickly.
Which one is that?
So here's this is normal, and then the more blue you see, the worse it gets.
Why does it have child up there? Child.
Yeah, just to show that the brain is developing. When we're a child, that's normal, but and then we're gonna, as we learn, our brain develops.
Okay.
Shows the mentality you kind of go back to. Yeah.
Goes backwards.
Is this also
Here's a good picture of
encephalitis?
atrophy.
Does that show up as such for the encephalitis? Because there again, you get the dementia responses, but you also get the fluid buildup and the gift in the same actions.
I really
I know
didn't.
you have encephalitis when a child is born. You can have it as an infant. My father-in-law had it years ago, and that excelled his dementia right off the bat. And I know now with these little kids, and we've had students in our classroom that were born with encephalitis, and they have the shunt put in the back in the brain. And I don't recall anyone saying how they detected it. That's why I was asking.
Right. Fluid on the brain is can be reversible if you have a shunt. I had a friend's brother. He went missing for 3 months, but when he was finally located, it was the water on the brain that caused it, and he had it shunted. But the longer you go without shunting, the more permanent some of the side effects can be. So look at the nice plump brain and look at the one that's shrinking.
It almost looks like it deflated.
Brain atrophy. The brain actually shrinks. Cells wither, then die. Abilities are lost. With Alzheimer's, area of loss are fairly predictable, as is the progression, but the experience is individual. Here's some more normal and atrophy. You lose immediate recall, attention to selected info, recent events, relationships. You can keep your long-term memories restored for a long time. Just ask me about Christmas. Confabulation.
What is that?
Now, people with alcohol-related dementia, I've seen them be very, very good confabulators. They'll tell you a story that you would think is real until you realize, no, it's not. You preserve your emotional memories and your motor memories. I've seen people who are very, very good pianists still playing on the piano, but don't ask them what they had for breakfast. And people with Alzheimer's disease can read you like a book. They still get body language and your tone of your voice. So, you know, it's worth it to put on a smile and be kindly, because they can read your body language. So when we lose our understanding, we can't interpret words. We miss some words. We get off target. But we can get facial expressions. We can hear the tone of your voice. We can get some nonverbals, and we can cover. Sometimes people are very clever at being good jokesters. And they'll make a joke and make light of it, and they're socially covering.
Louise, that slide before, the bigger slide before this one,
Uh-huh.
is that the brain?
Yes, I can go back.
Or it was just bigger than that?
They slice it after they passed away.
Oh,
Yeah.
and I can go back. Yep. So you can donate your brain to science yet, I think, so.
Definitely. Good idea. Thank you.
Yep, and the one on the right, you see
Yes. Such a
the
shame.
atrophy in it. So we have our sensory strip, our motor strip, and that's where we get speech and rhythm. And here again, you can see the atrophy. I probably wasn't born with a rhythm section to my brain. I don't have good rhythm at all.
I wasn't.
So we might lose our ability to know our body and our position, our ability to locate and express pain. Pain can go either way. I've had people with dementias not feel pain, and I had a girlfriend whose grandmother had dementia, and she carried a cane, and every now and then she'd just reach out and whack someone with her cane. But the bottom of that was they weren't keeping her arthritis pain well controlled. So it's useful to, if you need Tylenol 4 times a day, take your Tylenol, control your pain. And you begin to lose the ability to do your independent skills, like dressing yourself, feeding yourself. I can't tell you anymore, go make a pot of coffee. I might have to say, put water in the coffee pot, put 2 scoops, yep, break it down step by step, yep. Language, you lose, it's called paucity of speech. The spaces between the words get longer apart, and there are fewer words, and you might just use a simple phrase, and you have difficulty expressing yourself, saying what you need, but you can still sing. So I think that's wonderful. I think everything is combined in singing, rhythm, speech, long-term memory. Impulse control. Labile just means that you're easily emotional. So when you lose impulse control, like the grandmom, she would think it, say it, want it, do it, see it, use it. But you still have a desire to be respected and in control. So that's your ability to work with someone with dementia, is being kind and respectful to them. And when we are caregivers, they do end up learning how to push our buttons. And the Alzheimer's, it's a national effort now. The Alzheimer's Association is working towards abuse of people with dementia, that they're being used. So they might push our buttons, but there can be that clever person down the street who can just make magic happen and get some money out of the deal too. So you got to be careful about that. You know, the memory is damaged. It's difficult to, it's impossible, in fact, to learn new information. So what they say, what I've read about preventing Alzheimer's, it's not enough to do something and use your brain, like if you always like to do crossword puzzles, to keep doing them. It's learning new. So take up Spanish, take up French, take a new class, and it's that process of learning something new that helps keep your brain exercised.
New synapses. New synapses.
New stuff.
Yeah.
Yes. Oh, yeah, new synapses. Yes, thank you. Exactly right. Yes, we want those connections. So I'm happy to answer questions, and I have a handout for everyone. Sometimes another popular question I get is, what are the stages of Alzheimer's? And you can think of it either in the 7 steps, or you can also think of it as early, middle, and late. So in the early stages, you don't really notice anything. Then there might be the onset of some mild forgetfulness, and then it gets progressively worse. You can't recall recent events. You don't recognize your need for help. That's very frustrating to caregivers when they want to help and the person says, no, I'm okay, leave me alone. In stage 5, people actually get disoriented to time and place, and the recall is getting worse. In stage 6, bathing is a feared activity. So I know already I hate water parks. I do, I really do. I don't like getting splashed in the face at all. So, and that's what's behind the fear of bathing. And in stage 7, the final stage, a person is really bedbound and can't do for themselves. Yes.
On one of those slides, it said infections.
Right.
What kind of infections?
Well, what's the one all children should be, or when you go off to college?
Meningitis.
Oh,
Meningitis. You should, that's, be immunized for meningitis. But people who are caregivers, they will say, if my husband gets worse, if my wife gets worse, I immediately get a dipstick urine test done because the UTI will make everything much worse.
Yes.
AIDS also causes, there's AIDS-related dementia. And then there's also Jakob-Creutzfeldt dementia, which is a virus. And people who do autopsies, you have to be universal precautions for that because that's viral too. Excellent question, Linda.
And one young, early onset,
Yes.
do they know what causes some people to get that early onset?
Most of the time they say Alzheimer's disease is not inherited. There's a stronger genetic link with early onset. I once worked with a woman who was 40 when her dementia set in. Little stronger link with early onset. And the other thing I haven't talked about tonight, and I do want to mention, is there is mixed dementia. You don't necessarily have just one pure type. You can have Alzheimer's plus multi-infarct. You can have Alzheimer's plus diffuse Lewy body or the frontotemporal. So they're giving mixed dementias a good look at these days now too. Yes.
There's a movie that was out years ago, and we do show it to our students, called Still Alice.
I was just
That
going to
is an
say
excellent
that.
movie, and it helps caregivers get the understanding. The woman, she was a professor, and she noticed changes in her life that was going on. She was forgetting things, and all of a sudden she starts documenting everything. And she knew, she went to the doctor early, and she was in her late 40s and acquired it.
Julianne Moore.
It's a book, too.
There's the book, and they made a movie
It
out
was
of it.
first the book. I'd like to see the movie. I never saw the movie,
It
but
is
the
a-
book is excellent.
What is it called? Still Alice, Still Alice. Her name was Alice, and it shows how her family responded to it, but with her, it was hereditary. She has a daughter, 2 daughters and a son, and the kids go ahead and get tested. The one daughter is pregnant for twins, and she has the gene, and that also adds to it. So I mean, it's a wonderful movie, and probably 15, 20 years old, but it is out there. We do show it to our students and help them.
Do you know our next healthy lifestyle?
It's a
Okay.
very good book. But I would love to see it.
What's it called?
Still Alice.
Still.
STIL.
Still Alice.
You think that movie would be at the video store?
Could be, a real video.
Could be, it's an older movie, and we found it at a garage sale or somebody that downloaded it.
Tanya, can you tell us our next healthy lifestyle?
Yes, our next healthy lifestyle workshop will be September 30th at 5:30. It's on suicide prevention. Laura Johnson, which is a administrative supervisor over at CMH, will be here for that presentation.
And our next lunch and learn?
And don't forget, you can call and register with me for that. Our next lunch and learn is September 18th, and it's getting organized with Connie Kramer.
Oh, you will love that. Connie does a super job on organization. We had her speak at an auxiliary event, and the sheriff's posse had her come speak because she loves horses. And that's how she learned to clean tack and be organized with her dad. So thank you all for coming out tonight. Thank you very much.